Hi, and welcome back to the NCS podcast, current series. This is Lauren Koffman. I'm a neurointensivist at Temple University in Philadelphia, and today I'd like to welcome on the podcast authors from a recent Currents article, Innovation for Healthcare Disparities in Hemorrhagic Stroke, Drs. Rachel Forman and Drs. Nirupama Yechoor. So Dr. Rachel Forman is a stroke neurologist at Yale, and Dr. Nirupama Yechoor is a neurointensivist at MGH Brigham and Women's. So thank you both for joining us today.
Thank you so much for having us.
Yeah, thank you for the invitation.
I'm super excited to hear a little bit more about social determinants of health. You know, it's kind of a hot topic in medicine right now. Before we get into it in terms of the specific patient population, could someone just tell me a little bit about like what is social determinants of health and like how we apply it to medicine?
Yes, definitely. I think it's at first important to define and really understand what social determinants of health are. So these are conditions and the environment where people are born, live, work, worship, and age that affect a wide range of health and quality of life outcomes. So some examples of this are safe housing, education, access to food and physical activity, air pollution, literacy skills, and racism and discrimination. And we typically think of health risk factors as medical comorbidities and don't really consider social determinants of health as typical risk factors. So for instance, when we're talking to our patients with stroke about risk factors, a lot of times we're talking about high blood pressure, high cholesterol, and we don't typically include social determinants of health in these conversations. But we're really seeing more and more how much they are.
Awesome. So now that we know a little bit about what we're thinking about, how does this specifically apply to like the patients we take care of, stroke patients?
Great question. So there are actually already multiple studies that are shedding light on social determinants of health that may explain some of our stroke disparities. For instance, for people living in the southeast part of the country, as demonstrated in the REGARD study, there was an increased risk of stroke. And one explanation for that might be that states in the southeast have less investment in social safety nets. So for instance, government-funded food assistance, and less healthy dietary practices. Also, social isolation, which so many of our patients with stroke have, has a fourfold increased risk of stroke in people that are over 65. And one more study I wanted to just mention was a study last year published in JAMA that found that historical redlining was associated with modern day stroke prevalence in New York City, which was independent of contemporary social determinants of health. So we're learning more and more about how these are risk factors for our patients with stroke.
Oh, so I had no idea that all that work was being done. I thought one interesting point in your Currents article was talking about the differences in like population level versus individual level social determinants of health data. So could you just explain that a little bit about how is it challenging to look at this on an individual level?
Absolutely. So social determinants, as Rachel really nicely mentioned, sort of impact patients on all levels. So individual patients, definitely have face their own challenges in terms of where they live and sort of, what environments they live and work and play in. However, social determinants impact large populations, as Rachel just alluded to as well. The one limitation that we've sort of noticed in our research so far is that when we look at individual level social determinants data, especially from the electronic health records, we tend to sort of pick up on things such as educational attainment, zip code, race, and ethnicity. But we have really limited ideas of how these actually impact people and their healthcare decision making. And so one challenge that we've noticed in individual level social determinant data is not only that it does not paint the full picture, but it also limits us in what we can actually address and change for our patients.
Okay, and you also touched upon like the concept of qualitative research methodology, really when we start to bring in the patient and the family into this process. So can you just tell us a little bit about that?
I think,
Yeah.
go ahead. Sorry.
No, go ahead.
So one of the things that I think that we really need to start integrating into stroke research and outcomes research is really how our patients and families perceive health and healthcare. So one of the innovative ways that, we're using in our Buer collaborative project is qualitative research methods, as you mentioned. And so what this actually does is bring together patients, caregivers, and stroke survivors and ask them how what challenges they face and how they actually perceive, health and healthcare. This research is really difficult. It's really new. So we are, really happy to be doing it, but it actually understands the patient's perspective. And I think it's really important to understand the gaps which they face when they think about their healthcare and healthcare decision making.
Okay, great. And I know you just mentioned it's a collaborative project, and we'll talk a little bit about what each center is doing in a bit. But before we get to that, can you just tell us why you decided to focus on intracranial hemorrhage?
Yes, absolutely. So one of the things that we notice is that hemorrhage patients not only, have really high mortality and morbidity, but one of the things that the research in the past 2 decades has shown us is that there has been absolutely no gains in secondary prevention after hemorrhagic stroke. Meaning, while we have amazing new therapeutics and studies looking at the acute management of intracranial hemorrhage, we have less sort of to offer our patients after the stroke happens. And so as a neurointensivist, and it's a lot of the patient populations that I see and take care of. And so this network is sort of dedicated to focusing on an area of stroke research that I really think has been overlooked in the past decade.
And how did you, I guess, come together as a group? You're from different centers across the country. Like, when did this process start, and how did you guys decide to work together?
So this is a network that's really rich and diverse and has been built through the American Heart Association called the Yechoor Network, and it involves Yale University, UCSF University, and MGH. And what it allows us to do is that in all three of our centers, we really see the life course of hemorrhagic stroke. So our UCSF colleagues are pediatric stroke neurologists, and at Yale and MGH, we typically take care of adults. So this project is all funded through the American Heart Association. However, we're really able to capture our pediatric patient populations all the way to our adult patient populations. So it's a really rich network, and it's diverse because it spans the entire country.
Okay, and how often do you guys meet, and how are you like targeting patients or their family members for recruitment?
Great question. So we have a monthly meeting, but we also have a lot of network specific meetings where we get together in person. And we're we're leveraging all the technology and resources available to us. So not only are we referring, stroke survivors to each other, depending on where they live across the country, but we're also, recruiting through online resources and through stroke specific organizations, as well as just using community-based organizations in our 3 different centers.
Awesome. And could you tell us a little bit about how investigating these structural determinants can also impact recovery at the level of the health systems?
Yeah, exactly. So, our last aim of this big collaborative grant that we put through was not just, thinking about the patient perspectives, but really matching it to what happens at the health systems level. So while we identify areas of need from our patients and our caregivers, we're also seeing what we currently do at the health system. If we know these two things, we can sort of match, what our patients are saying and what we are doing in our practice and see where the gaps really are to come up with new interventions. And we want to do this because we think that there's a lot of systems level interventions that we can, create that will really help secondary prevention and really, help our patients in their recovery after a hemorrhagic stroke.
Okay, and let's now kind of get a little bit more information on what each of you are doing at your institution. So Rachel, you're at Yale and you're working on the patient advisory board. So can you just tell us how was this developed? When did you start this process?
Yes, thank you for asking. And I do want to just thank Nirupama for leading the effort to the Yechoor Collaborative Project. It's been amazing to get to work with the 3 different centers and just learn from each other. So before we got involved with this, the Yale Patient Advisory Board was actually started last year for stroke patients who have both ischemic and hemorrhagic strokes. And the point of that is to understand the lived experience with what they go through with their recovery from stroke, and specifically how they navigate having high blood pressure and managing their blood pressure. So we talk about, how do they check their blood pressure at home, the confidence they have, what they would do if their blood pressure was elevated. The ultimate goal is going to be to try to come up with a intervention for blood pressure that is desired by stroke patients and created by stroke patients. So it's been really, really empowering to get to listen to their experiences and start coming up with some ideas.
Were there any unanticipated challenges along the way as you were kind of setting up these meetings?
Yes, great question. The tech challenge has been the biggest challenge for us. So, a handful of patients have been really lucky to be able to just get onto Zoom and participate pretty easily with us. But there are a handful of patients that are not able to get on Zoom. We have a guy who's living in his mom's garage, for instance, who, can't get on every time. And, we have to include patients like him. And another patient of mine, a 39-year-old Black woman who's, hemiplegic from a stroke and is relying on her 14-year-old son to help her around the house. And she has a hard time getting on the Zoom meetings. So again, we don't want to leave patients like her and the other gentleman out. We need to hear everyone's story to be able to help everyone who's had a stroke. And the way we've kind of navigated this is we've just had one-on-one phone interviews to try to understand their experience as well.
Is there any particular story or something you learned from talking with these patients that really resonates with you that you'd like to share?
Yeah, it's people are really willing to talk and share their story if you're willing to listen from a place of just genuine curiosity and wanting to understand what they're going through. There was a woman, the same woman actually, a 39-year-old. She wasn't coming to any of her follow-up appointments. People had been calling her every week to try to get her to come and do her therapies and show up to her appointments, and she just wasn't coming. And just from having a conversation with her for 10 to 15 minutes, she explained that she just doesn't trust any providers, doesn't want to come. She feels very confident taking care of herself and her blood pressure on her own. And I think just being able to understand that about her, and if anyone had really kind of taken the time to just learn that about her, we could have approached this in a very different way and helped her on the level that she needed. So I think just really coming at it from, judgment-free, genuine place of curiosity, wanting to understand their experience, and then helping them on the level that they need help.
Okay, Rachel, why don't you introduce one of the board members to us and we can get to hear a little bit more about their perspective.
Great. Thank you so much. So I have the immense pleasure of introducing Mike Foster today, who is a member of our Stroke Patient Advisory Board at Yale. And Mike is also kind enough to volunteer his time being part of the Viewer Collaborative Project as well, and has also has joined us at a StrokeNet meeting. So he is a stroke survivor who has been a champion for advocating for other stroke survivors, and we're really grateful that he's partnered with us.
Thanks for joining us, Mike.
Yes, it's my pleasure, and thanks for the glowing introduction.
So why don't you just tell us a little bit about what made you want to get involved in this process?
Well, as Rachel indicated, my stroke and what I've been through in my journey has led me to have a number of opportunities to talk about what I went through with others and work in terms of educating stroke survivors. Again, talking about my experience, but also talking about opportunities that are out there to get involved in stroke survival and various educational opportunities.
And how soon after your stroke did you start working on this?
Well, I would say my experience with Rachel and other stroke survivor groups has really only been about a year, or a year and a half, call it. So I would say, my stroke happened 4 years ago. So 2.5 years into it.
And how did you learn about this opportunity?
Good question. I first got involved with Gaylord Health, Gaylord Health Services, I suppose it's called. And that's a big rehab hospital in the New Haven area. And from them, I learned about various groups like the New Haven Stroke Support Group. And through the New Haven Stroke Support Group, I learned about Rachel and a couple of other groups that I got involved with over time. And Rachel's groups, various groups, have been incredible. An incredible resource for me, but also an incredible opportunity for me to speak to others.
Mm-hmm.
Like StrokeNet, for example, that was a wonderful opportunity.
And you mentioned it being incredible. Can you maybe describe what's meaningful about this for you?
Well, let's talk about StrokeNet. Talking to doctors, I mean, I was kind of blown away at the level of education in one room, and hearing what they were doing and the research that they were doing and how it did or did not apply to me, but how it could apply to so many others and what you can do to help them facilitate grants. It just opened up my eyes to, all the kinds of things that I've gone through as a stroke survivor and how it can either help somebody with years and years of education and writing grants and what you can do to help them understand how better to do that and how better to reach out to stroke survivors, or having a conversation with a stroke survivor that has concerns about their next step, or where they are in their journey. For example, I was talking to a woman. I work with the neurologists and the PT and OT people out of Nuvance Health, which is down in Norwalk, Connecticut, different hospital group. But there was a patient there that was a stroke survivor, but she didn't drive. And the occupational therapist gave her my name because she knew that I was driving. Now, I had a very different kind of stroke than she had. Mine was a hemorrhagic stroke. Hers was ischemic stroke. But she was very, very, very concerned about driving. And, is that going to impact people that are on the road? Should she have another stroke? She was very nervous about it. And I was able to articulate to her what I went through and what my thought process was when I was learning how to drive, and what I went through to get certified again to drive, and how I got educated to drive, and, driving left-handed, left-footed, everything's on the left-hand side. And despite all of that, she still does not drive. But it gave me the opportunity to understand what were the issues that she had to deal with. And at least I could articulate what I went through. And, it didn't help her to take the next step, but at least it gave me the opportunity to speak to somebody and at least impart upon them my experience. And this is the type of thing. Well, this is the type of thing that I get out of working with Rachel and the various groups, because you're talking with other survivors and you're learning from them, and hopefully they're learning from you.
Yeah, I hadn't even thought about that whole other aspect of, sharing your experience and challenges and kind of just getting back to normal life.
Absolutely. Like one of the things I do is I ride a recumbent bike, and it's been retrofit. Again, everything is on the left-hand side, the brakes, the electronics, everything. And I worked with a group up in Rhode Island, and they helped me get into it and got the bike fit for me. And, it was a process, but, that's just another thing that you go through in terms of your learning. Now, an interesting story, and I'll bore you with this because it's germane to what we're talking about, sort of. I'm going to Sarasota Memorial down here for physical therapy and occupational therapy. And as I was entering the hospital, there's a guy sitting in a wheelchair, and he sees me ride up on my trike. And I got up, I got off it, I locked it up, walked over, and as I'm walking in, he said, "That looks pretty cool." And I explained to him where I got it, and I asked him, I said, are you ambulatory? Can you walk? He said, "Yeah, I can. I'm in a wheelchair simply because I'm coming out of the hospital." But I was shot 19 times. And he was obviously going through tremendous amounts of therapy to get back to where he could walk. He says, "I can't use my right arm though." Or my left arm rather. And I said, "Well, don't worry about that. If you can pedal a trike, a recumbent bike, and you can steer with one hand, they can put all the mechanics on the right-hand side for you. So all the braking and everything else that needs to be there for you is available on the right-hand side." And he was so excited. I mean, the guy was beaming. And I was so excited that he was beaming at learning that something like this is available to him. And I went upstairs and I found out who his physical therapist was. And I had him brought into my session and I said, "Listen, this guy's name is," I forgot what it was, but I know he's a patient of yours. And I explained the story of his involvement with, or his engaging me downstairs. And I went through the whole thing and I said, "Here's why I bought the bike. They can put you in touch with somebody down here in Florida. You can help him figure out how to buy the bike because there's tremendous resources available." And he could virtually get the bike for free. And if you could get him into it and it's a way for him to exercise, it's got to be nothing but positive. So they were very excited about it. I was able to impart that tidbit of knowledge to them and hopefully help him because what that guy's going through, it's certainly not stroke related, but man, he's come so far in his own physical journey that it was kind of exciting for me. Anyway, I've gotten way off track. Sorry.
No, I appreciate hearing these stories because I'm taking care of people in the hospital, and these are honestly things that I don't necessarily think about as they transition out of the hospital and back into life.
Yeah.
Rachel, is there anything else you wanted to ask Mike for our listeners to hear?
I did want to comment that I do really appreciate the back and forth between the stroke survivors on the group and on the meeting. And, Mike also is an avid golfer, which he hasn't shared yet, but he has taught himself how to golf again with using really one side of his body. I'll let him share his handicap score on his own. But he has been able to, he is part of a group of golfers who've had strokes, some stroke survivors. And it's been really nice for some of my other patients, even in clinic, for me to share that resource that Mike taught me about with people that are really, depressed that they can't do the sport they love anymore. So I think, even if the really intention of these stroke advisory boards is to progress research and learn about, different barriers to blood pressure, for instance, the other effect, and it's really beautiful as a provider, is to watch these different patients communicating with each other and supporting each other.
It's been fun, actually. Your group has enlightened me. And I'll say his name is Mike, not his last name. But Mike was so interested in golf and he couldn't figure out how to get into this group. So I hope that I've been able to put him in touch with the right people that will help him facilitate that.
Definitely.
Yeah, he's great.
Thank you so much, Mike, for joining us today. Is there any other last few words you want to share with people?
I would just suggest that if you've had a stroke and you need that support, oftentimes it's difficult to get into a stroke group, or at least I found it difficult to get into a stroke group of people that have a very common type of stroke as I had. Or what I'm trying to say is it's difficult to get into a stroke group where you've got a lot in common with the people that you're in the stroke group with. A lot of times, because ischemic stroke is about 80% of strokes that are had, most strokes you get into are people that have had an ischemic stroke. Occasionally, there will be one or two people that have had hemorrhagic strokes. And that's about what it works out to be. If you've got 10 people in a group, 20% of them have had ischemic or have had hemorrhagic strokes. So what they've gone through is a little bit different than what I went through. Working with a group of people that had hemorrhagic strokes is a great opportunity because you can impart your experience and they will impart their experience. And again, it's a give and take. And hopefully everybody learns from it. And that's what I would encourage people to do, is to get involved in a stroke support group so that you can share that experience.
Thank you again so much. And thanks, Rachel, for inviting Mike to chat with us.
Thanks very much for I really appreciate being involved.
Thanks for sharing that with us. And Nirupama, you're kind of taking things from a different perspective, really working on like taking stock of who the stakeholders are and trying to better understand our practices and what we need to intervene on. So could you just share a little bit about what your project is?
Yes, absolutely. So, as I mentioned before, a part of this study is also looking at how we as providers communicate with our patients. And so we're sort of tackling this in a two-pronged approach by getting the patients and their perspectives, but also seeing what providers and how providers communicate. And so we call, in the public health, there's a term for this called organizational health literacy. And it's how sort of we make it easy for patients to access, find, understand, and act upon health information. And so what this project is really focused on is looking at the neuro ICU at MGH and seeing what the standards of practice are. I think once we sort of compile them, we can start to identify where we can improve things. And so we've started doing that already. So the beginning of this project was to bring together key stakeholders in the ICU, all the way from nursing administration and medical administration, bedside nursing, advanced practice providers, residents, fellows, and attendings as well, and to see how people sort of view communication in the neuro ICU. And after we've done that, one of the things that we identified was that we do not provide different formats of education for our patients and their families. It's almost all in verbal communication. And so we've undertaken a project to actually come up with a physical model specifically for a tracheostomy, and to see if we can give some adaptive communication in the form of video explanations as well as written explanations to improve this really large gap that we've identified in our critical care population. So we're just about to implement our intervention, and we're really excited about it. And I think that it will be the way that we're going to sort of measure what success looks like in this project is not just by healthcare, utilization outcomes, but we're also going to see how providers and patients like the intervention, see what it has helped with.
Awesome. Do you have any idea when you might have some results on that you'll be able to share with us?
Yeah, I would love to. I think by like early summer is what we're really hoping for. The intervention is going to go for a couple of months, and we've just deployed like our pre-intervention survey. Just understanding what even people think about communication in the ICU is a really like unknown gap, I think. So we're really excited about the project, and we'll be super excited to share our results.
Awesome. So I know you guys both do a lot of research. You have funding. It's very collaborative. But for those of us that are like clinicians in the neuro ICU, what advice do you have for us in terms of how we can really include social determinants of health when we're taking care of these patients?
I think that's a great question. And knowing that, when a patient comes to us in the ICU, they've been through so much in that one day, but really that their life story starts, long ago. And there's so many things that impact people's health that happen before they end up in the neuro ICU. And while we can capture some of those metrics, with our EHR data, I think the really first place to start is just asking patients and families about, about their diagnosis, about their journey, and about their perceptions in recovery. So I think like the basics for anybody to kind of get involved in this research is just have more open conversations with your patients and your family members.
Yeah, I want to add to that. I mean, this actually came up at our advisory board meeting earlier this week, and a lot of people mentioned that they just don't remember anything about being in the hospital, and really the hope that they would involve providers will involve care partners, family members, friends, just to help that extra layer of support.
Okay. And for anyone that's interested in participating in what you currently have have been working on, how can people do that? How should they reach out to you?
So one of the ways that, we have been advertising for our study is actually online. So I'll be happy to include the link that we provide more information about our study. We're inviting, stroke survivors and caregivers to kind of come and participate. I think if you're a clinician or if you're a healthcare worker and want to get involved, we'd be happy to sort of give demonstrations about this idea of organizational health literacy. I think it's really prevalent in primary care, and people are sort of, singing its praises in the work that it's done in better communication practices with patients and families, and I'll be happy to sort of put you in touch with resources and give more information on that practice.
We're also able to enroll remotely for our qualitative post-stroke or post-ICH well-being. And Nirupama, you have someone from out of state, right?
Yes, we are actually recruiting from all across the country, and anyone can join. So one of the unique features of this study's design is that all of our sessions are held via Zoom. And a really big part of this is also dissemination of what the study results show. So we're working on building a website so our participants of the past and future participants can see kind of what their contributions lead to.
Oh, so really anyone taking care of patients with intracranial hemorrhage should like reach out, because it sounds like this is something that our patients, it would be helpful to them to kind of be able to participate in this experience.
Absolutely. And I can't tell you how much positive feedback we've had from our participants about just being in a group with other people with the same lived experience. It's such a powerful, motivating, a session. I can't just even as a physician, I'm so deeply moved. So I would 100% encourage people to reach out.
Awesome. Well, thank you guys for joining so much. Any final words you want to share with the listeners?
That just brought up about, that's such a powerful thing you just mentioned, Nirupama, about it motivating other stroke survivors. One of my advisory board members actually gave up smoking, which has been a lifelong struggle for her. And she really mentions how the board and having that to come to and for some reinforcement has helped her and just feel like she can open up more about her struggles. So, and then going back to like the social isolation piece, just having a platform and community for stroke survivors to talk and get to know each other. I'd really encourage people that take care of patients with stroke to provide resources to their patients.
Great. Well, thank you both for joining. We'll make sure we include a link to the article in the show notes, as long as the link that you mentioned, Nirupama. And so to check out this out or other Currents content, heads to currents.neurocriticalcare.org. As a reminder, NCS offers free CME for select podcasts. Listen via the NCS Learning Center and complete a short survey to receive your credits. Otherwise, you can access the NCS podcast wherever you get your pods. And don't forget to add us to your favorites to make sure you never miss an episode.